Welcome back to Beyond the Plan. Mother's Day just wrapped up, and for one weekend, everyone was talking about the women who do it all. The ones raising kids, building careers, and somehow keeping everything together at the same time. That feeling does not have to stop on Mother's Day. Today, we're talking about how employers can take that moment and actually do something with it, because there's a real opportunity here to build benefit plans that reflect what working moms actually need. It's not just a card, it's not just a post, it's something that will actually show up in their real life. My guest today helps companies do exactly that. She's a benefits consultant and she knows this space inside and out. Jennifer De Moura, thanks for being here. Welcome to the show, Jen De Moura.
Thanks so much. I'm very excited to be here. Thanks for your time today.
Of course. So we both know that women's health is there's a huge push for it right now out in LinkedIn and in the industry. What do you think is missing there? Do you think that it's all for show, or do you think that there's really a push for it right now?
It's finally out in the open. It's no longer a niche when it comes to women's health across the country. So it's definitely not for show. There is a push and it's not going backwards anytime soon. It is here to stay. It's about time.
It is about time. It's long past time, but we're good on that. What do you think that employers need to know to keep the momentum going?
So when I think about the Canadian industry, employers are very genuine when it comes to their intention, but you could absolutely see that there's no structure when it comes to women's health and what really matters. It doesn't really translate in their benefit designs. So the market, as we see on LinkedIn, as you were talking, is filled with content and point solutions, but there's not really any clear starting point or roadmap that kind of feels practical or employer friendly. That's where they kind of get lost. The best way is literally just to kind of reach out to their current advisor and ask them to do a deep dive in their current plan so they can identify what those gaps are when it comes to women's health.
What kind of things should they be looking for? A lot of our audience are advisors, and this might be new to them too. What kind of advice would you give for what to look for?
So there are absolute patterns when it comes to women's health. The industries that are affected the most are health and education and nonprofits. You could definitely see it when it comes to high-cost drugs. You could see it when it comes to mental health claims. I think women contribute 70% of all counseling claims when it comes to the benefit plans. So those are the key factors right there. Even if they're not aware, they could always look at the census when it comes to their current groups to see how much of the population is women, and that would explain a lot of the claims and the usages alone.
And you've been working on this for quite some time now. This has kind of been a passion project for you. Have you noticed a specific place where employers are getting stuck in this process?
Absolutely. They don't know what to do. They look at their plans, they don't understand why they have the same claims year over year, and that's because women's health was never a topic before that they would explore. All the plans are very generic, but they're not made for the current workforce today, right? I think women overall, we contribute 84% of the working force in Canada. So it's different than what it used to be before. So when they put in their modernized plan from before, it's not modernized now. So they really need to kind of follow some kind of diagnostic where they could identify those gaps. Because if they keep changing the plans and you see that there's no solution coming out of it, switching carriers over and over again is not the solution. It's in the plan design itself. That's where they need to start.
That's interesting that you said a diagnostic. Do you use a tool for that, or did you build a tool to do that?
So when I was looking at some kind of options out there, it wasn't really kind of narrowing down the scope of what I was looking for. So I did create one myself. I have my own women's health diagnostic. I have a light version that I could give out to employers just when they ask, no problem, I'll send over an email, it's a PDF. And then if they would like to do a deep dive, depending on their score, then they could just email me and then I would just do a full audit of their plan. And then we could dive into all those gaps and provide them all the solutions.
That's awesome. What kind of questions do you have in there? I'm picturing this from an employer's perspective who, let's say they've never even had women employees and now they're starting to have women employees and they want to support them. So I'm picturing it as a very lay person experiencing this diagnostic tool, what kind of questions are you asking them?
So the light audit is pretty straightforward. There is an easy scoring system, 1 out of 5, and at the end they could either get out of 50, which is strong alignment with women's health, or out of a 24, which is likelihood of avoidable spending and escalating claims. Some of the questions here, which maybe many employers currently don't offer on their plan, is if they include any kind of pelvic floor physio, lactation support, postpartum recovery, or mental health screening in their plans. A lot of times when women are going through postpartum, they're looking for these services, but their current plan does not offer any kind of coverage. So it's a big gap there. Another big thing that many people are not aware of is that most paramedicals do not cover any pelvic floor support, which is very strange because after women give birth, they definitely need to go in for pelvic floor physio, and that is not currently covered in their plan. Everything from that to if they know where their members could start their care, either virtual or in person, or if their plan allows the flexibility to kind of go in and make adjustments mid-year. That makes a big difference as well.
That's crazy that like pelvic, like I know that we're behind on women's health things, but you'd think that anything surrounding childbirth would be like top priority. Like recovery from childbirth should be the number one thing that we're all looking at as how to support women, because that's when you want them to like feel supported and feel like they are welcome to come back to work and they feel the best they can in their physical body. It's I won't get on my soapbox, but it's just crazy to me that that is something that is not like the front of mind, but that's really interesting.
It's crazy. It's crazy. Women, we have come so far in this world, and I think we are very fortunate to live in the environment that we live in now, and everything that we're able to do compared to what women used to do before. And we see here, society is trying. Everyone's trying, and there's been big differences. But I think that the work that we continue to do today will absolutely make a change for the women of the future. And I'm just very happy and lucky that I could be maybe a part of that change, both of us. So
I love that. I hope so. I hope that together we can be. Do you have like a story or a case study that inspired you to do this as something that you make part of your daily work?
absolutely. So there was this one case in particular. I had a Canadian nonprofit reach out to me, and they wanted to kind of add some kind of coverage when it came to fertility and menopause. When we looked into their plan, because they're a nonprofit, once again, they were 82% of their workforce was women. And then I gave them my women's health lifecycle diagnostic, and they scored a 12 out of 36. Definitely not the best, right? And then when we investigated their plan, we saw that they had a lot of unmanaged high cost exposures, including an MS biologic. Women are actually 3 times more likely to have some kind of autoimmune disease compared to men. So especially when you see those high cost biologics on the plan, and then you see that the dominant workforce is women, then it kind of cues in. It creates a kind of predictable pattern. So since they wanted to kind of add fertility and pregnancy aligned benefits, what we did is we added our formulary guard, which took off that high cost drug, significant amount. And then we also uncovered other savings by adding a dedicated My HSA fertility bucket. So that means that it's available to those that need access to it. So not everyone gets to kind of dig their hand in the bucket, but it is there if they need it. And at the end of the day, it made a big difference. And someone actually did have a baby from it recently, which is great news. And we didn't increase any overall budget when it came to the employer. So that's really what kind of gave me the inspiration to kind of look into this and kind of focus more when it came to women's health. It was very exciting.
That's amazing. That's such a good, like, that would get me inspired too. That I am inspired, but if I was like firsthand as the consultant on that and I saw that that was the outcome for one of the employees, that's so inspirational. And I wanted to go back to a point that you made because you were talking about how a lot of people start this benefit planning and they're looking at the ones that everyone talks about: menopause, fertility, perimenopause, even preconception care, postpartum. Those are the ones that come to mind, but there's a lot of things that women deal with besides reproductive health that are also different than the standard like Western medicine has looked at thus far. What I've learned from doing this podcast for so long is, like you said, autoimmune illnesses are actually something that women deal with more than men do. And also things like neurodivergency, like ADHD and autism, they're underdiagnosed in women, and a lot of women in their adult life are going for that type of care. So it's really interesting that people are, leaders and employers are looking at how to expand their benefit package for those almost low-hanging fruit items, but then there's actually a lot more to unpack there, like high-cost drugs, behavioral assessments, and the like. So that's really awesome that you're doing that, and good job. I'm really happy for that employee that got their baby in the end. I'm sure that was really rewarding to hear about. I also wanted to go back to like how you kind of talked about having a carved out HSA for them, because we do see that quite often now, especially for groups like you said that they don't need everyone to dip their hand into a bucket for fertility. That's not something that I think it's now 1 in 6 or 1 in 5 couples in Canada are experiencing some type of infertility, and not everyone needs to have access to fertility treatment, but it's so cool to have something like an HSA on the side that is available if they need it, and then they can even dip into it depending on where they're at in their journey. Because another misconception in the fertility space is that anyone with infertility is going to spend $20,000 on IVF. That's just not true. That's like a huge jump. Typically, it's going to be a journey that starts with medication, ovulation induction, trigger shots, tracking, and then maybe some other type of IUI or something like that. There's a journey that gets them to IVF. So I find that a lot of advisors they're a little bit scared to add a fertility benefit because they're like, well, no client wants to give everyone $20,000. I'm like, that's not what that looks like.
Conversation I hear a lot, but I think people don't know, especially advisors, they don't know the flexibility of HSAs. And the more I looked into it and the more conversations I had with people like you and other people on your team, when I think about the flexibility of HSAs, it's a chef's kiss. It is so underutilized. It is the most underutilized tool and benefits, and it's one of the most powerful. People absolutely have no idea. Again, we had a targeted bucket design for women's health needs, like fertility testing, menopause support, pelvic health care. And again, it doesn't have to apply to everybody, but it's there if somebody needs them. So HSAs are just very flexible, intentional, and very versatile. And employers don't know what they don't know, and advisors also don't know what they don't know.
Yeah, I find that if you're just willing to sit down and learn what the journey looks like and what kind of balances and what kind of expenses you might actually be exposing yourself to, there's a lot to learn. And I've also seen it in the past where you can have a carved out HSA with different tiers of treatment. Because like I said, you're not always going to just be cashing in a $20,000 IVF. A lot of times there's other little costs on the way, like medication that might not be that much, but it's just something to help them along the way. And then you can even bring in a wellness spending account, a taxable spending account that's specific to fertility. And it can have things like ovulation strips and at-home testing kits and, fertility trackers and the wristwatch and everything like that, or a diet plan, or there's so many different things that can be done to make it a more holistic benefit plan. I'm going to talk to you about the women's health life cycle. So like we said, there's a lot of benefit options that are being catered to women to focus on those milestones, like we talked about maternity, menopause, fertility, things like that. But women's health needs are continuously evolving. How do those map into different career stages, and what are you seeing? Because we know there's leadership pressure, caregiving pressure, and things like that are impacting women as well.
So when we are in the working force, we are going through so many cycles during this time, this amazing time in our lives, and that is between the ages of 24 to 54. And a lot of times the benefits kind of focus, like you said, on a single moments like maternity or menopause, but women's health is not, I'm going to say it again, it is not episodic, it is continuous. And when we move through these predictable stages, cycles, fertility, pregnancy, postpartum, caregiving, perimenopause, menopause, all of that, each stage shows up in the benefit plans either through access issues, which we see a lot, drug use with those high biologics, and sometimes disability, which is knock on wood, which nobody wants. And these health stages absolutely overlap when it comes to career growth and leadership pressures because it happens during our advancement years, right? And then when we have these performance expectations at our highest and we don't have the same care at the same time, it directly affects our progression and leadership continuity.
Yeah, I know I've experienced that myself even. I've had obviously a very fortunate trajectory into leadership and everything like that because I've had such good supportive employers. But as someone who went through a fertility journey myself, there were definite interruptions to it where if I didn't have the support I needed and the benefit plan I needed and even the flexibility in my work life balance, I probably would not have been looked at as a strong candidate for leadership because I had, I would take a week where I needed to work from home, wasn't feeling well, or things like that. And that's kind of, I guess, specific to a fertility journey. But with any type of, those continuous journeys that you talk about, it's not episodic. It does have to be something that we're looking at on a continuous basis. So outside of the, obvious things that women are dealing with, the ones that everyone kind of keeps reiterating, there's also kind of hidden pressures like the burden that women experience managing their household and being the manager of their family. What do you do in the benefit plan to try and support with that?
So, as we know, majority of the time it is women that are taking care of household responsibilities, raising children, taking care of their parents, and that comes with mental strain and high counseling utilization. But what we also do not keep in mind is that most of the time these women, because we're there and we're taking up this extra, I don't want to say burden, this extra workload, we really don't have the time or direct access for some kind of virtual care. So a lot of plans do not offer some kind of access to an EAP, but an EAP makes a massive difference when it comes to some kind of benefits plan. It gives those women an opportunity to access a doctor online and have a consult online without physically having to leave their home. So they could stay there and they could take care of all the extra workload that's kind of thrown on their shoulder. When we look at the counseling utilization, I think I mentioned before, women do account for 70% of that. So if we do add in these extra products and these extra tools for us to access from the comfort of our own homes or wherever we are, it makes a very big difference on the claims utilization and in the long term, the productivity for your employee and overall their health and well-being.
I agree. And I think it's interesting to see I was kind of thinking back on your statistic of 70% of the counseling is being utilized by women. I'm curious, what is the cause for that? I'm sure a lot of it is the invisible labor. I actually agree with you. I like to move away from the terminology of burden because a lot of women probably don't identify with calling it a burden. But I also wonder in a more positive light if it's that women are so comfortable with seeking out help and talking about feelings and things like that. So that was just something that stuck out to me was that 70% of the counseling is, women that are utilizing that. I think it's really interesting. I have a pretty great friend group of women in their 20s, 30s, 40s. And so many of them just go to therapy and counseling proactively. They're not going when something's wrong. They're not going when, crap's hitting the fan. They're going just to do the general maintenance. And I think that is such an important part too of the benefit plan is not just having things in place for when something goes wrong, having everything in place so that we can maintain our health, be proactive about our health. It's so important that we have those resources available instead of having to fall back on it when it's a rainy day and you're, really, really struggling. I think that that's something also that I've been really inspired by the women in my network for kind of like, I was like a late adopter of that. I was always like, oh no, I'm fine. I don't need to. And then I had so many friends that were going as if it was going to get your hair done, going to get, lash extensions or whatever is your relaxing spa day. A lot of women are like, oh, I'm going to counseling every week. And I was like, I want to try that. And I started doing it. And I just thought it was so cool that women are like spearheading that.
I think it's great. Just keep it as part of your maintenance routine, and I think it makes sense. And I don't think it just should just be women. Everyone should do it. I think it'll change a lot of people's perspectives on in life and just help with their maintenance.
100%. Yeah, 100%. And I think that it would also help people feel more comfortable talking in general, whether they're in the office talking to their medical practitioner, or they're, in their relationship talking, or they're with their friends. Like, I think that men, especially, if they can feel more comfortable talking to their buddies about things that are going on in their life and things like that, I think that would just be such a positive impact on us as a whole. So, I want to talk about this timing because we're releasing this podcast around Mother's Day. And Mother's Day is a really complicated day for a lot of women. It's very, you're being celebrated if you're a mother. If you're someone who's going through an infertility journey, that can be really challenging. If you're a woman who's experienced a loss, that can be really challenging. If you're a mother who's in the sandwich generation and you're taking care of your kids and your own mom or your own dad, that's also really, really challenging. So it kind of brings up these themes of, invisible labor, caregiver load, mental health strain. Where is the gap, or what do you define as the gap between awareness of all of this and then making actual changes?
So employers are very aware that there is some kind of demand, right? And that there needs to be a change. But you could only do so much until you kind of put your words into actions. So to kind of adjust their plan, we really need to remove the friction. And the friction is better access to better benefits when it comes to women's health, a smarter plan design with the intention of virtual care and clear communication. Many times people are just kind of thrown a benefits plan. And a benefit plan that no one understands is just wasted spend. So they really also need to invest some kind of time to really educate what their employees could do with these benefit plans. Nobody wants to read that 60-page manual. Did you read your 60-page manual? Nobody wants to read the 60-page manual. So that is such a big difference because these plans are not cheap. And we just want our employees to have a very healthy life. We want them to enjoy their place of work. But if we're not putting that time and that education to really let them know what you could take advantage of this plan and how it could better you and your work and your life career, why have a plan?
Yeah, I 100% agree. I think there is so much benefit waste in the world and it's crazy because in a lot of these plans, most of these plans, employees are paying their own dollars into it in premiums. And they are not even taking advantage of it because the line that I always think of is like, it's not worth the headache. So if it's a headache, if it's a 60-page benefits booklet, you don't want to read it. If it's not accessible or it doesn't relate to you or you can't figure out what has to do with you and what doesn't, that feels like a place where you're going to see wasted benefits. If it isn't flexible in that, there's a small limit for counseling, a small limit for drugs, and then they have other things like paramedicals they don't need, I find that like that can create a lot of benefit waste. And that's where I think that having a balanced plan with an HSA where the employee can say, I have this for my high cost drugs, I have this for my, annual optometry, dental, all of that, but I have this defined, dedicated dollar amount that I can use for my own specific care journey. I think that that's like a really important piece. Again, we're kind of going back to the same conversation as before, but I do think that it's such a powerful tool, like you said, so underutilized. And I think that it really reduces benefit waste. And I know for me, any job that I had before I got into benefits, the first couple days they give you that benefit booklet and they give you a few hours to sit down and go through it. I would just sit there. I wouldn't even read it. It's crazy. And the employer's paying for it and they put effort into it and they sit down in renewal meetings. And at that time I was paying into it and I still was like, I'll crack it open when I need it. That is not the way that benefits should look. It should be something that's accessible.
We want to maintain our life, our career progression. So just use it as maintenance. That's exactly what it's there for, right? And like you said, HSAs are so versatile. Like, for example, on a typical benefits plan, we have a certain amount of scaling units when it comes to sitting in the chair at the dentist. But a lot of employers are unaware that when a woman is pregnant, 80% of them develop some kind of periodontal gum disease. But when you have reached the limits in the scaling chair, you're out of pocket for that. And if you don't have the funds for that, it could turn into some kind of disability claim. Another crazy thing where my HSAs come in as a big help is that vision is capped usually every 12 to 24 months. Your vision changes when you're pregnant. when you don't have access to change your glasses, the HSA is there to kind of save the day. It's just such a versatile tool that what you don't know, you don't know. And many employers and many advisors really don't know the versatility and the big flex it literally has on a benefits plan. So
Absolutely. There's so many things, like as I've worked through, I mean, growing up as a woman, having sisters, having friends, and then being in this industry, I've learned that pregnancy is not just morning sickness. Morning sickness isn't even morning sickness. It's all day sickness for people that have it, most cases. But it's not just morning sickness. You know, your belly bump is growing and you have like sore feet and swollen feet and stuff. There are so many, like you said, dental implications, vision implications. We've heard of people going for hyperhidrosis for like sweating and stuff like that changes, varicose veins. There are so many things, pelvic floor. Your mental health can change. You can be put on different medications for helping with nausea. Like it is so different than what everyone perceives that having a big benefit plan with like lots of different options for people is so important because I know so many people. I have a huge family. I know so many people who have been pregnant before, and I don't think that every single one of their journeys was exactly the same. Now had a totally different pregnancy, postpartum. Yeah, completely different. So it's really important that everyone feels seen in their benefit
yeah, so
plan.
how do you cater to that? Because everyone has their own individual needs, right? So to create a plan that could cover everything, it just becomes generic. And that's why it's so important to really understand how health spending accounts work because that's how we tailor it to the individual. And every individual person can be tailored to at the company, just with the flexibility of an HSA. But many people are really unaware of the education of an HSA. Everybody. It's not just employees, it's employers, employees, and advisors. So it's really a game changer. And I think it's the next generation of benefits. Like that, to me, is a big solution of it. So
I love to hear it. I actually do agree. I do think that an HSA is so underutilized. It's taught, like I did a little bit of studies. I just did my GBA 1 and 2. But I did it in the perspective of coming in from only knowing the industry through HSAs. I am pretty green when it comes to insurance and things like that because of my upbringing being my HSA. But I was blown away by how ancillary they make an HSA look. It's like insurance, and then an HSA is like a little tiny moon in this orbit of, and I all I could think was, man, it is so much more of a life hack than that. There's so much more that can be done with it than that. And it doesn't have to just be this little ancillary product. It can actually be a huge piece of the core product, if not the core product. I think there are cases where an HSA could be the core product and insurance could be there to wrap around it. I think that they need to be worked together way more, but it's interesting. It's interesting to hear that coming from you because that's the hard part for us is educating advisors on how this can be used as, and a lot of advisors don't even know that you can carve out an HSA. They think that if you give someone an HSA, you have to give them, like all the access to everything. And we always tell people you can make it a derivative plan. You can make it as derivative as you want. We have people building HSAs purely for specific drugs like Ozempic and things like that because they don't want to drive their high cost drugs. So they're putting it on an HSA. You can make it specifically to one item. And then to your point about employees, I have so many people that I know that have an HSA and they don't even look at it because they think it's for like a gym membership. And I'm like, that's not even an HSA item, that's a WSA item. So there's a lot of education, but that's a good segue into my next question, which is once you've built this benefit plan with an employer and you know that it's really only going to have the impact that you want it to have if they educate the employees effectively. What are your tips for them? Is it like a group session or is it an exercise? Clearly not the 60-page benefit booklet, but what do you suggest for educating employees on their benefits?
So I think the importance is really understanding that so much time and money is put into a benefits plan. So it's really, really relevant that they continue the education. It's not just a one time and done. Maybe they could do yearly segments. I also think it's very important that they understand where their advisor comes from, depending on what company they come from and what that company offers. I know at People Corporation, we have implementation specialist teams, client care specialist teams, disability specialist teams, and all these teams, there are dedicated personnel to sometimes in person go in and do educational sessions, but most of the time team sessions. And it's something that could be touched on every year. We send out newsletters, we send out videos, we have platforms, tools to constantly educate your employees. But it's super important that the employers continue the education, especially if you have advisors that are willing to do that for you, then you're in the best of hands. The advisor makes the biggest difference when it comes to their benefit plan in general.
I agree. I think it's so important that employers are honest with their employees and they don't assume what the employee is going through. They need to assume that someone in their team is experiencing one of these things at any given time. You can't just say, well, all of my employees that are women are under 40, so no one's going through menopause. You don't know. That's not a diagnostic tool. You can't say, well, I know this employee so and so doesn't seem interested in having kids, so they're not going through any of that stuff, so we don't need it. That's something that I hear all the time from employers where they're making assumptions based on their employees and what their employees need. And they don't realize that those are not the readily available conversations for employees that they're going to bring up to their employer. They're not going to talk about their reproductive health. They're not going to talk about their pelvic floor. They're not going to talk about their fertility journey unless they're like me and they have like no walls. But I think that it's so important for employers when they're educating employees to generalize the benefits, but also make sure that the employees know that it's a trusted space, that there's a benefit there for them. If there's something that is very specific to someone, or it could be very specific to someone and you just don't know, mention it anyways, because you never know. You never know what someone might go through now or be going through later, that they'll go, oh, 3 years ago I didn't want kids, but now I really want kids and I'm really glad I have this benefit available to me.
Employers get lost in that middle ground where everything's okay until it's not okay. Until they see a high cost drug or a big claim, because everything's been okay for so long and they're like, nothing's going to change. Because they think they know their employees, but at the end of the day, you said you don't really know what you don't know.
We don't even know our own health. Like, as employees, we don't even know what's going to happen down the road, right? So it's really important to just have those things available. How do advisors start to have these conversations then with their employers? How do they start, and what do they do after the conversation? What's the first step?
It's so simple, okay? Advisors, listen, it's very, very simple. It's just one question. Is your benefits plan designed to support both men and women across all stages of health? Or was it built around averages that no longer reflect your workforce? And then to make it real, the advisors really need to run some kind of diagnostic, like how we've been talking before. And then even if you find many, many gaps in the plan, just prioritize one or two high impact fixes. We want to modernize the plan intentionally and absolutely, absolutely use tools like My HSA to close those gaps without adding any kind of complexity. Just by asking that simple question, it'll make a big difference. Because at the end of the day, women's health is not just about women's health. It affects the workforce performance. It affects the continuity and outcomes for absolutely everyone.
Well said. Mic drop. And what do you wish more employers knew about benefits today?
I really wish that employers really understood more that women's health, it is not a niche issue. It's here to stay. It is not a niche. It is not a taboo. In Canada alone, it is one of the most predictable drivers of workforce risk, contributing to hundreds of thousands of lost workdays, 560,000 days to be exact, and 3.7 billion in productivity loss seen through absenteeism, disability, and unmet healthcare needs. So instead of paying those dollars as unmanaged exposure, employers can simply just reinvest them into smarter benefit designs that actually work for the entire workforce, not just women. So I really wish that was something they could kind of see more and just take away from all this.
Another mic drop. That is so important. So Jen, this is kind of the ending of the podcast, and I think it's very clear that you and I have a very shared interest in not just women's health, not just the trendy topics, but the actual meat and potatoes. I hate that phrase, but the real like important parts of women's health and women's healthcare built into benefits, and then just building better benefits overall for the whole entire workforce. Is there anything else that you wanted to kind of touch on before we close out today's segment?
Yes, I think that it is absolutely important that everyone continues doing this work. And to me, when I say everybody, I also especially mean women continuing to uplift women. I believe that the difference that we see in the realities that we live today are due to us sticking together and lifting up each other and showcasing all of our work. If we have a lot of female advisors that are unaware of the gaps when it comes to benefits or HSAs, then they should definitely reach out to us with any questions. Don't be afraid to ask. Don't be afraid to do research, because this is something that will change the future. It's not about changing benefits plan. It's about changing the future for all the next generation of women to come. And we are a big contributing force to that. So I'm looking forward to seeing what it'll bring.
I 100% agree. I think we're changing our industry, which then will domino into healthcare, which will domino into advocacy, which will domino into women being represented properly and across all industries. And I love what you're doing. Thank you for coming on the show today. Thank you for sharing your passion with us. I cannot wait to see the difference it has.
I'm so happy you gave me this opportunity to hop on your amazing podcast, and I'm very excited to see what the future brings for us. Stay tuned, everybody.
Thanks for joining today's episode of Beyond the Plan. If today's conversation got you thinking, head over to getmyhsa.com to explore what modern benefit plans can actually look like. And if you want to keep up with us between episodes, you can find Jennifer De Moura and myself on LinkedIn. We'd love to connect. See you next time.